Excuse me. Good morning, everyone. And so all of you are muted, and so that is by design. I requested your IT to mute you because if I can hear voices, tendency is I get distracted. And thank you so much, Primex, Mrs. Valdomar, Joe, and everyone for giving me this opportunity to share with you a very important subject matter. And I would assume that you see me and as well as my presentation. I haven't provided you these particular materials, but then after my presentation this afternoon, I'm going to email this to Roland and to Nestor, and they will be the one who's going to send it to you. Now, first of all, since most of you do not know me, there's only a few people in Primex that I deal with. And let me introduce myself. So you can see in the slide, my name is Joey Tugong. I'm a certified workers' comp professional, a certified risk management specialist, and a juris doctor. I have been with Primex for the last 8 years. I provide consultancy services in the area of risk management. Risk management, I don't have to explain, you know that already. It's the elimination, reduction, or mitigation of any forms of possible exposures or liabilities. I've been in the business in the healthcare industry for the last 20 years. I started as a dietary aide, serving food to the residents, and then rose through the ranks as a payroll person, accounts payable, assistant business office manager, assistant to the administrator, then a human resource for 5 facilities, then eventually as director in risk management for at least 21 nursing homes, or in the past it was around 26 nursing homes. So I know this business. And so this particular subject matter that we have, as you can see in the first slide, environmental services, a vital role in infection prevention. I guess this is something new for you, because in these pandemic times that we have, there are 2 ways of getting infected, and our minds are wired towards one particular infection or the transmission, and that is direct contact, which stands to reason that all of our frontline healthcare workers, including all of you, the support services in the facility, we are trained to wear PPEs because of direct contact. Because we know if you are within 6 feet, and if you are not wearing the proper PPEs, such as the surgical mask or your N95s, your goggles or face shields and gloves, so if you are within 6 feet, then there's a possibility that you're going to get infected, or if you are infected, that you're going to transmit to your residents or co-workers. Because as you know, the basic of this particular virus, you get it aerosol, born through cough, through sneezing, and simply by talking. And so if you wear these PPEs, then you're protected. But there is another way, there's another route where you get infected. That is what we call indirect contact. In short, surface contact. And this is the particular subject matter that I would like to share with you. So if you know, or if you're going to comprehend and understand and implement these particular policies and procedures that I'm going to share with you on environmental services, most likely this will reduce the rate of the spread of the virus in your facility. Indirect contact, contact surface. Why? Our residents, when they sneeze and cough, or any of your co-workers, does not necessarily have to sneeze or cough, but when they touch their hands and they're going to touch any of the objects in the building, or in general, the environmental surfaces that we have, the chairs, the beds, any of the furnitures that you have, along the hallways, corridors, residence room, residents, or you're going to touch it. And when you are going to touch it, and you're going to touch your face, and your face has 4 mucous membranes. These are openings. Your mouth, your nose, your eyes, and your ears, then you get infected. So it is very important, therefore, for all of us, as one, to work on the area of environmental services. Hold on. How come it's not moving? Yeah. Ronald, is there something wrong with my presentation? Hold on. Ronald, are you in? How come I cannot
Yes,
move?
sir.
How come I cannot move my slide?
And you click the
Okay, 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 okay.
There you go.
Okay, I'm sorry for the brief interruption. Before I'm going to roll out the environmental services policies and procedures that we need to implement in the facility, it is very important for everyone, for all of us. And normally when I conduct a seminar, I give them the lay of the land, world, the nation, United States, the particular state that we have, and the particular county that you're involved in. And we all know in CDC guidelines and including the Department of Public Health, community spread is very important. You must know the community spread in your area because our mitigation protocols would always be in response to the community spread. So we should know the numbers. Everything is data driven. So that if you know the numbers in your community, at least you as administrator, the DON or the infection preventionist, you can take extra steps, proactive steps to advise your workers not only to protect themselves in the building but as well as outside the community. Because we have lots of cases and instances where when an employee tested positive and then based on our contact tracing, they ended up having their COVID positive as a result of community acquired. See? So it's very important then to know the community spread in your facility, in your area, so that you can advise all of your employees, please, when you're outside of the building, please, as much as possible, if it is non-essential, proceed straight to home, and then home to the facility. But if there are essential things that you need to buy, then do so. Go to the grocery, but practice the three basic principles. One, wear a mask. Two, practice social distancing. Three, constant hand hygiene. Now, so this is the data that I gathered yesterday. So globally, we have 18 million confirmed cases. And when I say 18 million, this pertains to around 209 countries. Okay? This includes territories. Of course, 18 million, and we are more or less 7.4 billion. That's the world population. Not unlike during in 1980, the Spanish pandemic flu, half of the population were exterminated. Half. But for the COVID, no, we are not there yet. And hopefully, because of all of these companies engaged in the pharmaceutical companies, they're working hard to have a vaccine. So hopefully, when we have that, at least this will reduce the rate of infection, or if not, totally eliminate. Of course, infectious diseases, we all know. We have to be very practical. We cannot eliminate it. So that's worldwide 704,365, and in United States alone, we are 4.9 million and counting. That's 160,000 and counting. So we have facilities in the Los Angeles area, a county in California. And so if you take a look at this, confirm 527,186, and the total deaths in California, is 9,703. In Los Angeles, we are number one in California. You will be surprised. San Francisco is a very dense city because normally the spread runs fast, okay, in a dense population. But yet, it's Los Angeles, 195. And then that's 4,758 and counting. And a sizable portion of these deaths are our residents that stays in nursing home, in long-term care. Now, let's go to Tennessee. Tennessee, you have 112,441. That's 1,117. And I would assume you are in the county of Davidson. You see, in that county, you have 21,879. That's 205, which is a good number, huh? But of course, for everyone's soul, okay, everyone will grieve. It's hard. But then at least you know. So in the state of the nation, Tennessee ranks number 13. And of course, in United States, I guess it's New York, okay? Or if not California. So anyway, let's move forward. World. So if you see these figures, okay, this is as of July 6, you see the numbers that we have exponentially. United States is number 1, followed by Brazil, and then India, Russia, and next to Russia is Mexico. And how come United States is number 1? Is there something wrong with our mitigation protocols? Is there something wrong with the way that our public health officials is communicating with all the population, with all people in the United States? I really do not know. But what we can do is to protect ourselves, our facility, our employees, our residents. It doesn't mean that we don't care what is happening in the community, but us, we have to undertake mitigation protocols in order to reduce the number of confirmed cases and the number of deaths. So all hands on deck. All of us should cooperate, and let's undertake all the mitigation protocols that has been approved by the Department of Public Health. And if you can see here, in March and April, European Union countries, they were up. But if you see, take a look at this, May and June, they went down exponentially. While United States, I'll tell you, it went up. Why? Then, I might sound political, but it is because the politicians took a backseat and allowed the public health officials, the scientists, epidemiologists, immunologists, all of them were the ones who took, reign on how to mitigate the coronavirus. Politicians, they zipper their mouth in Italy, in Spain, in Greece, in Norway, in Sweden, in UK, all of them, kept quiet and allow scientists to come up with all of these mitigation protocols. So, in United States, let's forget all this political fanfare that we have. We will just think of ourselves and work with our residents and with our co-workers. Data in nursing home at a glance, okay? And this is as of 6/17/2020, June. And I'm referring to nursing home. You see where we are right now? California, Texas, Arizona, Arkansas, Louisiana, Florida, Alabama, Georgia, North Carolina, South Carolina. These are the states in the nation that had a strong increase up to now in cases of coronavirus. Okay? And so it is very important that we have to reinforce and strengthen our infection protocols, our mitigation. It is not something that we just write, but we have to breathe life into all of these policies and procedures that we have, especially our mitigation protocols, but because that is a mandate by the Department of Public Health. In fact, all of the surveys, forget about everything in your annual licensing survey. What we have now is focused survey only in infection control. So we really have to work on it very hard. And part of that infection control, part of that mitigation playbook that we have, include environmental services. And long-term care facilities, at least one coronavirus cases in all of the states of the nation. All. No one is spared. As far as Alaska and Hawaii, and even in Puerto Rico, okay, nursing homes were hit. Why? Remember, the type of residents that we have, these are elderly, dependent adults. They have underlying health conditions. So therefore, the possibility of them getting infected is very high. And if they get infected, uh, eventually they will end up with severe acute respiratory illness, ergo death. Now you must remember, other than those residents that we have, and this is based on data driven, those on dialysis, that goes on dialysis 3 times a week. And they normally, and based on my experience, they were the ones who ended up positive coming from their sessions in the clinic. But other than that, it is our employees that brings in the virus, and eventually our residents gets infected. Our residents, they are dormant, right? They are sedentary. They've been in the building for years. That's why it's called long-term care. And when coronavirus came into the picture, and who were the ones who brought it in? It is our employees. That's why screening protocols is very important. Very important. You don't just use your thermal or thermometer just to check. Ask questions. Where they have been during the last 14 days? Did they travel out of state? Do they have any symptoms, whether mild or severe, of coronavirus? Cough, fever, sore throat, shortness of breath. Ask these kind of questions. Because the first defense is excluding or separating our infected employees, okay, from transmitting the disease in our building. Now, nursing home data. This is as of 7/19. Okay, only nursing home around the state. Confirmed cases, 152,081. Suspected cases, 96,000. Do you see this? 40,273 deaths. Okay? In nursing home. But this is not only confined to our residents, but including our employees. Yes, there were employees that died in the process. And I can tell you, we have one employee that died. But community acquired. And we have one employee now for 2 months in a comatose stage as a result of the COVID-19. You see? Is this avoidable? I would say it is avoidable. That is my business in risk management. For as long as we are going to fortify our defenses in the facility, we follow all the strict protocols, these things will not happen. And you have to be very vigilant when it comes to employees that work multiple jobs. Multiple jobs. Meaning having second job. These are the employees that you have to be very careful. You have to ask a lot of questions. And as much as possible, I know there are shortage in staffing. If there is a way not to allow them to work with us, if they persist or insist on working in their other job, and since they're only part-time, then take them off the schedule. Especially so, if in their primary job, it's a COVID facility. You see? So you have to take a closer look of your, conduct an inventory, all of your employees that has secondary job. Okay? So, let's start now. So, the CMS chief, Seema Verma, said, nursing homes with poor ratings on infection control are more likely to have high numbers of COVID-19 cases. This predicate is very true, accurate. Very accurate. We are in this business, we know that. If you have no infection control, and if we have infection control policies and procedures, but if we have not implemented them, the whole 9 yards from A to Z, useless. Okay? There will be cracks in your policy and procedure, and then we will end up with a lot of COVID cases in the building. And you don't want that, right? Because it affects our employees and everyone. And once employees will be affected, including household members. So as much as possible, we really have to work hard in preventing, cases of COVID in the facilities by implementing to a T your infection control. As I've said, it is not only in writing. We have to really implement, everything. If it's a policy is a commitment, right? A procedure is you have to implement what we have committed to ourselves and to the agency. And your procedure must be simplified. Use layman's term. If your procedure has 1 up to 50, I mean, how could you implement that? Reduce it. Make it 1 up to 10 or 1 up to 15. And educate all of your employees. Train them. Messaging is very important in your mitigation playbook that you have. So what is infection control? Infection control is a series of steps that healthcare facilities take to prevent or stop the spread of infectious diseases. You see? Infection control is very important. Now, but you cannot come up with, all of these policies and procedures not unless you conduct a thorough assessment. You cannot formulate a policy, a procedure, in anything in the building, not unless you conduct an assessment. Now, this is my own assessment based on my experience since March up to current. Why do we have COVID-19 cases? Because of employees working in multiple facilities. And this one is also very important. Premature return to work. You see, we have employees that you place on isolation because they were COVID positive or on quarantine because of suspected exposure to the COVID-19 as a result of your contact tracing. You don't wait for the 14 days. You immediately allow them to return back to work. The worst type of employees are the ones who are asymptomatic because you do not know. I would rather know that an employee is symptomatic. At least I know, right? It is not an invisible enemy. But if it's asymptomatic, it's normal. So that's why it's very important that you place them on 14 days quarantine. No ifs, no buts. Okay? I understand your shortage in staffing. But you have to weigh risk versus benefits. Are you going to risk prematurely allowing them to return back to work? And what benefit are you going to get? Of course, increase of staffing. But on the other hand, the risk is the rate of infection will double. And you don't like that. Okay? You don't like that. If you have a lot of COVID, patients, and you get overwhelmed, and your employees have already abandoned you for fear that they will get infected, my friends, Department of Public Health is going to take over your facility. And they will take their orders from higher-ups from the state. I know that. Because I know some of our competitors, they ended up in that kind of situation. All of the residents were evacuated. And, it's like paratroopers, like the federal agents that went to Oregon. They're like that. It's like a military. They're going to take over. So you don't like that. Okay? And then we have lapses in contact tracing. Don't get idle. Don't just disregard. Once you ended up in your surveillance, in your response-based testing, of course, you start with your baseline testing. I'm sure you're already done with that. And then every time you end up with a positive employee or resident, what do you have? Response-based testing, right? You test all residents that are negative. And then if positive, you isolate them. You don't only isolate them, you do contact tracing. You see? That is very important. That is the purpose of testing, to physically separate so that the spread of infection will stop. Improper cohorting of residents. Oh, that is obvious. You know that. That is your business. So, if you have COVID positive resident, create a barrier. Exclusively COVID positive residents. And of course, everything is exclusive. Okay? Your employees, your residents, they will be confined in that COVID wing. They have their own donning and doffing, their own bathroom, their own break room. They should never cross towards the quarantine room, and more so in the general population. Very important. Porous physical barriers. If you're going to put up your plastic sheets, okay, see to it that it is properly sealed. Maintenance, please see to it that all the vertical possible gaps and including horizontal gaps, see to it that they are properly sealed. and you have this zipper in the middle, please zipper it up to, close it. Because I have done inspection, and I've seen the zipper is halfway. And therefore, it's aerosol borne, it will travel. It stays in the air for at least 3 hours. So I have noticed that. Of course, lapses in infection prevention and control protocols. And by default, it's the environment, which is the subject matter of my presentation. Surface contact or indirect contact. Okay. So where the rubber meets road. So it's a convergence. And the environment is a vast ecosystem. Okay. That is our business in the healthcare industry. But there are a lot of actors. Okay. This is not a one-man job. When we talk of environmental, everyone should get involved. But we don't want to end up with a confusing way of trying to solve the environmental issues that we have. There should only be one person who should take the lead, while the rest will serve as the support services. So it is integrated. Okay? So what we have are the following: infection preventionist, the DON and the DSD, and of course the maintenance supervisor, housekeeping, janitorial, and laundry. Because that is their business. Physical, the environment. Okay? But they are not the thinkers. They are the doers. The one who thinks, the one who assess and formulate, it will be the infection preventionist, right? Okay? So the goal of everyone is to prevent or stop the transmission of healthcare-associated infections, or in short, HAIS, healthcare-associated infections. Understand, this presentation was not formulated simply because of the coronavirus. Long before the coronavirus, okay, we already have this. Because there are a lot of bacteria and viruses in the building, the pathogens that we have, and this has already been in play years back. But this became more relevant because of the coronavirus. Okay? So therefore, if we want to solve the environmental services, surface contact, we must therefore have an institutional framework, right? An institutional framework, meaning when you say institutionalize, meaning we have to put people, and those people must have responsibilities, and responsibilities comes with accountability, right? And there must be assessment, there must be policies and procedure, education and training, and auditing, monitoring, and surveillance. Useless to have a policy and procedure, and then there is no institutional framework. So basically, these are the stakeholders. Infection preventionists, and correspondingly, what is the role. Thinkers, planning, assessment, and training. We have the maintenance supervisor, okay, handles logistics, okay. Getters, assessment. They're also involved in assessment and training. When we say getters, of course, these are your disinfectants. Disinfectants. The chemical, the solutions. How do you kill bacteria? It's through the solutions that you have. Okay? But you don't just easily buy these chemicals, these disinfectants. There must be a process. And that process is what we call assessment. And who assess it? The IP, the maintenance supervisor, of course, the DON and DSD, they are just support services, involve the housekeepers, the janitors, and the laundry also. Okay? Because they are in operations. They're the ones that does the cleaning, the disinfecting, the sanitizing, the deep cleaning, and the terminal cleaning. They must be trained and properly protected. So we need an engaged and inclusive maintenance, housekeeping, and janitorial services in infection control. So plain and simple, environmental services is basically housekeeping. But this is not the kind of housekeeping that you have at home. Domestic services where you just clean, see to it aesthetically that they look good to your eyes. No. Housekeeping in our industry goes beyond that. Okay? Now, so the fundamental question, my friends, ladies and gentlemen, what role does the environment play in the transmission of healthcare-associated infections? My friend, big time. Okay? You cannot see it. So what we do, therefore, come up with the policies and procedures, because these are our invisible enemy. We have to attack them frontally. Okay? even sideways and even backwards, okay? So this is how it works. Let's see first certain statistics. HAI is an infection that a resident contracts while in our facility. You see? These are the residents that we have. They have these healthcare-associated infections. They could be the one who brings into the facility, or as a result of their underlying health conditions, they're immunocompromised, and they ended up with all of these diseases. Okay? So anything that they touch, they cough, they sneeze, they talk, respiratory droplets that will fall into the bed rails, into the bed, into the linens, and then they touch, the door handle, the light switches, the TV, the remote, the call lights, the hands, major transmitters. And when you touch it, our nurses, CNAs, and everyone, and even housekeepers, if not properly trained, then they get infected. And the rate of infection will mushroom fast in the facility. Okay? And HSIs occur through all of the type of industry. Okay? Long-term care, dialysis, ambulatory surgical centers, and hospitals. So what is the significance? So healthcare environments are important reservoir for infectious microorganisms and are critical to address. Targeted prevention efforts can reduce the rate of some HSIs by 70%. 70. So if we are going to implement this, policies and procedures, it will reduce by 70%. This is based on research, based on study. This is not something out of the blue that they came up with. Of course, you cannot do it 100%. Okay? That's impossible. And all healthcare personnel play a critical role in targeted prevention efforts. See? All hands on deck, all of us. We cannot just say, well, this is the job of the infection preventionist. That's not my job. Oh, that's the job of maintenance. My friends, don't do that. Everyone must be engaged. But they cannot engage if we are not going to communicate, if we are not going to educate them and train them. A basic understanding, fundamental understanding of contact surface or indirect contact would suffice for those who are not directly involved in the implementation of this particular subject matter on environmental services. So what is the purpose of your infection prevention and control program? So, the facility must establish and maintain an infection prevention and control program designed to, one is to provide a safe, sanitary, and comfortable environment. And number two, to help prevent the development and transmission of communicable diseases and infections. You see, to prevent the development. That is where we are now. What we want to do. Okay? We don't have to wait. We can proactively stop the rate of infection by way of undertaking environmental services, okay, in these high-touch surfaces, okay, which I'm going to explain later. So, you must have a program, right? Okay. So, this program has 7 components on infection prevention. And if you can take a look at this pie, 7. Linen, and the main driver of your infection program, prevention program, is of course the infection preventionist. What is this 11/28/2019? It is a mandate by CDC, by CMS, by the Department of Public Health. As of 11/28/2019, you must have a full-time infection preventionist. Full-time. So in other words, 40 hours. Right? Full-time job. More so in these pandemic times. Because if we have an infection preventionist, at least we are guided. We are guided. Okay? We know what to do and when to get our orders. See? And then there must be an annual review and update, and then a system for preventing, identifying, reporting, investigating, and controlling infections and communicable diseases. Of course, we must have a written standards, policies, and procedures. We have to record certain incidents if they were exposed, ended up in the hospital by our employees as a result of disinfecting or sanitizing, and what are the corrective actions that we've undertaken. Of course, all of you know this, the antibiotic stewardship program. Okay? That's very important because, our residents, they have to take certain medications that would, prevent certain bacteria or virus to develop. Okay? Now, but we are not going to deal all of these programs. We will just deal those that is related to environmental services. So before anything else, we must do a facility assessment. Okay? And so you can easily find that from, you just go, type in Google, version 1.3.1, September 2016, Department of Health and Human Services, specifically Centers for Disease Prevention and Control, or short CDC. Okay? It is under the HHS. And there is particularly a tool for infection prevention and control assessment for long-term care facilities. Oh, don't worry, I will share it to you. I will send you that. Okay? So if you pull out that particular tool, these are the following subject or topics in the tool. Okay? So they call this the infection control domains for gap assessment. So there are, what you're going to look are the gaps. Okay? Your flows. Okay? You have to be true to yourselves when you do your assessment. Met, not applicable perhaps, there is a column. And there are certain items there that you have to check. Okay? So all of this, see, 1 up to 9. I will not discuss this anymore one by one. Okay? What is important here in my presentation is on number 5, personal protective equipment, number 4, hand hygiene, and number 9, environmental cleaning. The rest is a very long subject matter. Okay? So assessment is the key. Now, so we'll start with written standards, policies, and procedures in these key areas because we're talking of environmental services. So you must have a policies and procedures, right? I understand you have policies and procedures in housekeeping, in laundry, etc., etc. Okay? But we must make it relevant to the current times, especially on infectious diseases. So one on cleaning, housekeeping, and on laundry. And let's deal with this one at a time. Okay, let's start with cleaning. So, your policies and procedures on cleaning, okay, must have the following elements. 1, define lines of accountability and functional reporting lines and responsibilities for all implicated staff. You see? Very important. As I've said, responsibility is your job description. Responsibility equals to accountability. I give you this responsibility, this is your job description, then I will hold you accountable. If you fail to do this job, then you know already what is the consequence, right? You will end up with more or less a disciplinary action. Okay? And very important, reporting lines. We don't want our employees to get confused. Where to report? Where do they have to make themselves accountable? Very important. Okay? It must be in that policy and procedure. See? That's why when you prepare your job description, there's always a supervisor. It's written there. That is the person that he is going or she's going to report to or get instructions. Very important in cleaning, you must have a cleaning schedule for every patient care area and non-critical patient care equipment. Okay? I will discuss that later. Including the frequency, the method, and who is the staff responsible. You must also have contingency plans and required cleaning procedures for environmentally hardy organisms and for outbreak management. Okay? And this pertains to your isolation rooms, your COVID wings, your quarantine wings. These are very critical. There is a different way of cleaning an isolation room and a quarantine room versus the rooms in your general population. The type of disinfectant is different. So that is where now you're going to level. Am I going to do simply cleaning? Or perhaps deep cleaning? Or is it necessary for me to undertake terminal cleaning? So if a resident has already been resolved, the COVID-19, and you're going to move this resident to the general population, and then suddenly, you're going to end up with a quarantine resident that ended up positive, you're going to move to the COVID wing. Are you going to immediately repopulate that isolation room or the COVID wing? My friends, you have to wait for 24 hours. Ventilate. Open the windows. Open the doors. Okay? With yellow caution tapes. No one can go there. Wait for 24 hours. And then you do a deep cleaning. Okay? And which I'm going to explain later. So what are the training requirements and performance standards for cleaning staff? And very important is surveillance, monitoring methods, the frequency. Are you going to do it on a daily basis, a regular basis, or just occasional? It all depends. And who is responsible? Okay? And list of approved craft. This is very, very important. Supplies and equipment and any required specification on their use. You don't just go out there to Rite Aid or to CVC, hey, go buy their Clorox or whatever it is. Or no, there must be prior assessment. And what type of pathogens are you going to kill or to disinfect? It must correspond, okay, the type of disinfectant that you're going to buy. Because if not, then it's useless. It's just like a water that does not kill anything. So assessment, therefore, is very important. And you must read the label and the method on how to use it. We don't just give it to a housekeeper, hey, use this, and then go there. Start disinfecting. What are the PPEs that they're going to wear? Because we don't want them also to end up with, an injury or an illness. And then, see, list of necessary PPE and hand hygiene action is recommended for staff and patient safety. So this will just give you some of the elements when you do your policies and procedures on cleaning. Okay? So I keep on talking about cleaning, disinfecting versus sanitizing. Cleaning is very simple. It does not kill germs. You just use a simple detergent or a soap, then with water, and then clean. But it does not kill any bacteria, right? Disinfecting is a different level. The type of chemicals that you're using will kill the germs on the surfaces. But you should never, rule number 1, okay, the rule of thumb, do not buy any chemical products that is not EPA registered. EPA. EPA stands for Environmental Protection Agency. Or, if there is FDA approved, then fine. In the absence of that particular marking, you'll end up with a deficiency. It must be EPA registered. So, if you advise your central supply officers, if you buy, please see to it that it's EPA registered. And not only that, it must come with the safety data sheet or the SDS. In the past, we call it material safety data sheet. Okay? Every chemicals that you're going to order must come, number 1, EPA markings. Number 2, it must come with the safety data sheet. The safety data sheet is a long story, but it pertains to our employees, how to use it, what type of PPE, how to dispose these chemicals. And not only that, if they get exposed, you need that particular document. You have to bring that to the industrial clinic so that the doctor will know. It indicates the instruction how to handle this particular chemical exposure. Okay? But that's a long story. So sanitizing is a higher level also. It reduces the bacteria identified on the product's label on surfaces and in laundry. You see? It's more or less the same thing. Okay? It's like the twin brother of disinfecting. And the product's label must address that particular bacteria. So in other words, any chemical for that matter is not enough to kill the bacteria. It must be dovetailed, targeted to that particular bacteria. Otherwise, it will not kill, okay, that particular pathogen. Now, so in housekeeping, policies and procedures, you must address these following 3 areas because each of these areas are different. The levels of disinfecting or cleaning or sanitizing are entirely different. Okay? So 1, you must have policies and procedure on cleaning general areas or common areas. Always remember this. When I say common areas, this means other than residence rooms. You see? Very simple. So, residence room, any other rooms are called general areas, except those nursing areas. This pertains to your nurses stations. So, if you take a look at it, you see, the cleaning general areas, that is the common areas. You see? Perhaps in this area, you will only do simple disinfecting. Huh? Or perhaps simple cleaning. Dust, and then use the towel, wet it or spray it, and then use, just the simple chemical, and it will already clean because these are not high-touch surfaces. Okay? There are not a lot of activities here. Okay? Of course, in the cleaning nursing area as well. Of course, the rate of infection here. Okay? The frequency of touching the surface is high. So, come up with a policy and procedure with that. What kind of chemical or disinfectant that you're going to use. And, most important, is your resident rooms. This one is entirely different. So, you must have a policy and procedure if it is occupied. What kind of disinfectant are we going to use? What is the method of cleaning are we going to undertake? You see? And then you have to determine what kind of resident do we have. Does he has, a certain infection or exposure or the type of bacteria? So, this is a matter of assessment. And then the precaution rooms. Okay? Precaution rooms, these are your observation rooms. These are your quarantine rooms. Right? For every new admit or readmit, you don't immediately populate them in your general population, right? You have your quarantine room. Okay? So, there are different way of cleaning that. Those that has been discharged. After you discharge the residents, are you going to immediately put a resident in that room? No, you're not going to do that. Again, 24 hours. Okay? After done 24 hours, then do deep cleaning. And then, if you terminate an isolation room, okay, by resident, there is a different way also of cleaning and what kind of disinfectant that you're going to use. So you go through this motion. I'm pretty sure everything that I say here, it's very familiar to you. This is not something alien. So I just run this fast because I want to finish by 12. I don't want to hold you that much. So next would be policy and procedures on laundry. Environmental. It's not only housekeeping but including laundry. Why? Because contact surfaces in linens. Okay? Direct contact by residents because of the linens. Okay? They sleep in that bed and everything are linen. Huh? And we are not only talking of linens, we will also include the clothings of our residents. So our staff that works in the linen, the laundry, they must be very careful. Infection preventionists train them how to collect dirty linen and in transporting dirty linen. Okay? Policies and procedures in the laundry area. Okay? Or you have to have it clean. Disinfect your laundry area. You see? Because we have the soil and the clean. You don't want to cross-contaminate. Okay? And the type of barrels that you have, the clean versus the soil. Okay? There is a way of doing that. And how are you going to process the dirty linen? Will they just use their hands? Or do they have to wear a PPE? Or just simply a surgical mask and a gloves? How about a goggle? How about a face shield? Do they have to wear a gown? These are the lot of questions. Of course, I will allow them to wear a gown. If it pertains to those linen that came from the isolation room, the COVID positive. See? Versus those in the general population. How about the transporting of clean linen? Or you don't want any cross-contamination, right? Storage of clean linen, properly sealed, properly secured, properly inventoried. Care and cleaning of linen carts, very important. Okay? I don't know. Will it be twice a week or once a week? And how are you going to clean it? Are you just going to use simply a water and then, you just spray it? Okay? That is jet powered? Or do you have to use a certain chemicals or detergent? Now, assuming you're going to use outside facility laundries, the laundromat, okay? You must have a policy and procedure. But I'm pretty sure you don't have that, okay? So we'll go to the next program of the PI. Controlling infections and communicable diseases. Okay? We are now diving deeper. We have been talking about hand hygiene. Right? But there must be an origin. Who discovered and who introduced, hand hygiene? We keep on talking. So this is educational. The person that introduced and that discovered that hand are the major transmitters that would kill, a patient was Ignaz Semmelweis. He is a Hungarian but took up his degree in medicine in Vienna. So, he worked there in the maternity clinic of Vienna General Hospital. And there are two types of wards, okay? These pertains to women, There are two types of ward. One handled by the doctors and one maternity ward being handled by midwives. Midwives. At the time, Florence Nightingale was not yet available. Okay? Florence Nightingale around 1860. Okay? And so, Ignace noticed that the rate of death in that particular ward along with his co-doctors is 10 to 14%. And he was worried. How come versus the maternity ward being handled by the midwives, the rate of infection or the death is only 1 to 4%? You see? So it triggered him to conduct his own research. Okay? And all of these deaths pertain to puerperal fever or childbed fever. So he went to the maternity ward of these midwives, and he saw that all of the midwives are washing their hands. At the time, there were still no Clorox, no all of these chemicals. It is not yet been discovered. Water and lime. Water and lime. See? And then they started to clean their hands. And that is where he found out versus those doctors, they are not washing their hands. A lot of deaths. So that is where he submitted to the scientific community that hand hygiene is of utmost importance. Not only utmost, number one, hand hygiene, major transmitter. See? So always remember, his name is Ignace Semmelweis. Now, pathogen is a bacterium, virus, or other microorganisms that can cause disease. Invisible. It's all in our hands. So hand hygiene is very important. You see? We're talking about environmental services, right? Related to hand hygiene. Because the surfaces will end up with all these pathogens through respiratory droplets, or perhaps I touch my mouth, my face, I cough, I touch surfaces. You see? Now, if you don't practice hand hygiene, you touch, then you end up with the COVID. See? So hand hygiene is the process of cleaning your hands by using, these are the different methods. Simple hand washing, or you use an antiseptic to hand wash, okay, or a hand rub. Hand rub and hand washing are different, right? The hand rub is either foam or gel, okay, spray, 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 that's it. Hand washing, you have to go to a sink, a faucet, okay, or surgical hand antisepsis. Hand hygiene prevents the spread of pathogens. Of course, it could be, say, direct or indirect contact. Direct, a patient who is exposed, I touch without any gloves, then I get infected. When I eat, okay, when I touch my face, open membranes, mucous membranes, or I did not touch directly, but this resident who is infected, okay, hands, okay, infected, touch the surface, and here you are, you touch the surface. When you touch the surface, you now become infected, you don't do proper hand washing, you touch any of your mucous membranes, or the steering wheel of your vehicle, when you arrive at home, then that's where it all, becomes now serious, full-blown, okay? So hand hygiene prevents the spread of pathogens. Staff hands become contaminated through caring for residents. See? Why? Because the residents are the major source of all of these pathogens. Pathogens are removed through, again, hand hygiene, thus protecting both our staff and our residents. And so you take a look at this. Wash your hands before and after entering a room. Hands are a great source of infection. See? You can see the drawing. All of the types of bacteria and viruses are there. Okay? Now, gloves, therefore, would protect. Okay? Is to stop the spread of pathogen. PPE, very important. Especially in this pandemic time. So if they take a look at this picture, all of the types of pathogens, you have it here. And now, you see, MRSA, I'm sure, norovirus, you're very familiar with that. How do you stop that? Gloves. And then now we have the COVID-19. But you don't just easily wear a gloves. There is a procedure on wearing a gloves, okay, which I'm going to discuss later. So do you use hand hygiene when you should? It has been, based on research, that more than 50% of our employees, they don't practice hand hygiene, only 40%. See? Hand hygiene is often not practiced before touching a patient, performing an invasive procedure, of course, manipulating an invasive device immediately after touching a patient, after removing gloves, after touching items or surfaces. These are, things or activities that our employees are doing without observing hand hygiene. So if they fail to take this practice, then we will have, an environmental surface that would become an infectious disease. Okay? Now, so hand hygiene therefore prevents infection. So how do we do it? It sounds simple, but it is the manner of doing it. It is the attitude, okay? And the discipline of doing it. Yeah, all of us knows, okay, hand hygiene, wash your hands, but we don't practice the right way of hand hygiene. See? Wash hands with soap and water, of course. If visibly soiled with blood or other body fluids. Before eating, when? After using the rest, always. Whenever you use the restroom, tell your employees. When they leave, wash the hands. And I will come into that the rest of the details. When patients have diarrhea or C. difficile. Okay. There are no CDC rules. How many times you should wash your hands? There is none. Okay. But we have good practices. So there are two ways of washing your hands. Hand rub and hand washing. Already discussed this with you. Hand rub meaning, these portable things that you have. And those sensor that we have along the hallways, the corridors. Okay? Or you just press and then it's either foam or gel. But you don't just simply do that. There is a way. Always remember the rule. 20 seconds. 20 seconds. And not only, rub the palm. Tip of your fingers in between your fingers and your fingernails. And up to 2 inches of your palm. Okay? Whether it's hand rub or hand washing. That is what you're going to do. Now, if it is hand washing, since you're there in the bathroom, of course, then what you do, you must use a disposable towel to turn off the faucet. And that same towel, you use that also, if possible, to unlock the door. You see? Because it's useless. What if it's the faucet and the doorknob? Someone touch it who is infected. Then it's useless, the hand wash. Use it, same thing. Once open, then throw. Okay? Now, let's move forward. So this will just give you a picture. The areas most often missed during hand washing. The back of your hands, the palm of your hands. You see the red ones most often missed. Fingertips. Okay? Your fingernails. The in-between of your fingers. And so, tell them, please, and do it 20 seconds. There are 5 moments for hand hygiene. Everyone must be trained. Everyone should know this. Before touching a patient, before clean aseptic procedures that you're going to undertake, after body fluid exposure or risk, after touching a patient, after touching patient surroundings. See? 1, 2, 3, 4, 5. Very, very important. And this is not just simply out of the thin air. Hey, do the 5 minutes, the 5 moments of hand hygiene. My friends, this is evidence-based, field-tested, user-centered approach, designed to be easy to learn. See? Memorize, part of your training. 5 moments of hand hygiene. Now, but we should also have a policy on hand hygiene. Of course, we know that. On washing, on moisturizing. Because there are certain employees that are, they have allergies in their hands as a result of a particular gloves that they wear. Latex or hypoallergenic, you must have a policy and procedures in that regard. Perhaps they must, moisturize their hands first before wearing a glove. How about those employees with artificial nails? Will you allow them to come to work? Okay? Because artificial nails, underneath those nails, that is where all these pathogens will hide. Okay? Artificial nail surfaces. You see? All of this. How about jewelry? You have your engagement ring or wedding ring, and that is permanently in your finger. What are you going to do? What is your policy? Will you allow them to remove it every time at work? Or, of course, have it, maintain it, but there's a policy and procedure how to clean it, to sanitize it. See? How about those intact skin? Things your hands touch, all of this. Just go through the motion. Okay? Now, We are now going deeper. This is the kind of environment that we have in residence room. It looks dainty, it looks cool, it looks beautiful. It looks as if everything is perfect, right? Very enticing. So we have marketing, okay, we have these visitors, we are trying to convince them to stay in our room. Perfect. But my friends, if we go deeper, the inanimate environment, inanimate means dead, okay? Nothing moving. That is where you're going to see, all of these possible infections. So we call it the inanimate environment. So if you take a look at this XXXX, these are the environment. These are surfaces subject of contact by our residents. See? And you touch them. You see? When you deliver the care. So all of these are surfaces, contact surfaces that needs to be cleaned, that needs to be sanitized. That's why using a glove is very important. But even though you're wearing a glove, but if you have a contact with a resident, you touch the surfaces, then this becomes the transmitters. That's why our environmental services is very important when they do the cleaning, the proper way of cleaning. Okay? Now, this will give you a picture. So this is a resident room. You see the red? You see the green on the other one? Okay? These are your surface contact. You see? Enter the room, you see the door handle there. You have to open it, right? So our resident is going to touch that. The resident might sit in the chair, in the sofa. Oh, the hands will touch the sofa, right? The armrest. And then, of course, the bed. And the cabinets that we have. The lights. Okay? The remote control. All of this, you see? These are what you call contact surfaces. You cannot see it, but at least you can already identify what are the most frequently touched surfaces in a particular room. So that's why a visual assessment is very important. So that when your housekeepers will come into the room and clean, they already know what are the areas that they have to clean. It's not an easy housekeeping. This is not a house. This is a residence room. See? Let's move forward. Of course, the bathroom. The reservoir of all infectious diseases. These are the high-touch surfaces. See? All the handlebars, the grab bars, and also in where they sit, okay? And where they clean, the lavatory, the sink, the faucet, all of this. And if you look at the other, what's this graphic here? Furniture, sinks, floor, bed rails, overbed table, bed linens, patient. These are your contact surfaces that our residents touch. And our environmental services must know, okay, where to clean, okay, what to clean, and important, what kind of chemical to use. So, housekeeping. So, there are levels of disinfection, okay? But we're not going to use sterilization or high-level disinfection or intermediate-level disinfection. No, we're not going to do that. We are going to use the low level of disinfection. Because this one, the higher grade, this pertains to a hospital setting. Okay? So let's move forward. So, there are 3 types of disinfectant according to IPA and CDC. So, disinfectant pertains to the chemicals. So, the type of chemicals that we're going to use is the low level of disinfection. And it must be IPA approved. Okay? Because the intermediate and high level, we might end up, our patient perhaps, or our employees, seriously injured or ill. These are higher grade of PPEs that they must wear. They must already wear a full-blown, not only a face shield. They must, like this astronaut, perhaps that is only the kind of PPEs that they have to wear if they use that particular chemical. So we are in the low-level disinfection. A chemical germicide registered as a hospital grade or healthcare disinfectant by, again, IPA. Now, in surface disinfectant, the chemicals that you have, label matters. Label matters. So you don't just go out there, hey, buy this particular chemical. Infection preventionist, along with maintenance supervisor, the housekeeper perhaps, or you want to involve the DON. Okay, what type of bacteria in that particular room that we have for that particular resident? What type of chemical are we going to buy? So it depends on your assessment what type of viruses or bacteria we have in that room. So if you identify what type of bacteria, say of course now we know it is coronavirus or the COVID-19, then buy a chemical disinfectant, a product that could kill or disinfect, okay, COVID-19. You don't just buy any type of product. So that is very important. Label claims. So, you see, you can see here, okay, it will kill the following. You see? Avian, influenza A virus, rotavirus. See, this is the label claims. The label is claiming that these are the type of bacteria or virus that it can kill. But always EPA registered. Because if it's not EPA registered and it's made in China, then it will not work. You see? Not just because some of us, oh, it's cheap, we want to save money. My friends, the more we will end up with bigger liability exposure. So other than the label claims, very important is for us to know how to use. So all of the products has directions, manufacturers directions on how to use. So training comes in. Okay, housekeeper, all of you, this is the particular chemicals that we bought. This type of chemicals will kill this particular bacteria. Okay? And this is how you're going to use. This is the type of PPE that you're going to use. And this is the type, this is the contact time that you need to use in order to kill this bacteria. I will discuss with you later what is contact time. So directions is very important. You know, most of us, if not some of us, we hire housekeepers, we hire laundry, we hire maintenance. And then they will write down the experience there. That they have been a housekeeper in a restaurant or in a company outfit that does, domestic cleaning. And then you will say, hallelujah, this is good. That we don't have to train. My friends, we are in a different environment. Okay? Restaurant does not have, a patient there. Okay, with all of this type of bacteria and viruses. We are in a different level. We have to train them. Okay? And not only that, according to the mandate of the Occupational Safety and Health Administration, OSHA, we have to protect our employees. We must not expose them. So environmental surfaces, this must be evidence-based through assessment. So it doesn't mean that all surfaces has contacts, right? So we must conduct an assessment. What are the type of surface that needs to be disinfected or sanitized or cleaned? Assessment is very important. So we know environmental surfaces includes the ceilings, the walls, all of this. Are you going to clean them? It is based on assessment. If it is terminal cleaning, then you have to clean the chandeliers, the fixtures, the walls, the windows. Okay, that you're going. Okay, so you have to do an assessment. Perhaps cleaning may be all that is needed for the management of the surface. See, cleaning. What is cleaning? Dust. A simple spray of a water, and then that's it. Done. But if we identify through assessment that there is more to that, then we will now use, the chemical that in particular can kill that particular identified bacteria or virus. Okay. Now, so addressing surfaces is everybody's responsibility. We have business offices, social services, medical records activity. And what do? They are lazy. They will call housekeeping, please come to the business office and clean. There is a spill or what. My friends, can you just not do it? Do it! Especially in these pandemic times. See, everyone are overwhelmed. They are busy. Well, you have your wipes, right? And why don't you just clean it? Do it yourself. Okay? Don't expect them to come into your room every day and disinfect and clean your rooms or your offices. Let them concentrate in their job in residence rooms. So wherever you are, it is our responsibility. Let's do it. Okay? Then, these are the questions and which must be addressed in your policy and procedure. How do we assign responsibility? How? And how do we ensure that it is being done? And how do we monitor it? So all of these questions must be responded in your policy and procedure on infection control as it pertains to environmental services. It's very easy to answer that. I don't have to go into detail, but just answer these questions. Now, this is important. Microbial survival. Huh? When you buy the chemical disinfectant, you must know what time, remember, label claims, what type of bacteria or virus it can kill. Okay? And how many minutes, okay, can this particular chemical that needs to survive in that surface in order to kill that particular bacteria. Okay? So, this must be cleaned and disinfected thoroughly. Oh, how come? What is this? Nurses must inform housekeeping about this so they know how to clean. Yes, okay. So, our housekeepers, maintenance, they don't know about these bacteria and viruses that are existing in the residence room. They don't know it's microbial survival. You see? So, since you know, and your infection prevention should know, then they will inform maintenance and housekeeping. My friends, this particular room, we have this kind of bacteria, MRSA. And the survival time is 7 days to 7 months. So if you're going to disinfect, please use this particular chemical. And when you use this chemical, when you spray, okay, in order to kill, do not immediately rub. Leave it there. So that is in the direction for use. Because what we do, we spray, okay, a particular chemical. And then after spraying, we immediately rub. Useless. Because what it states in that product, leave it wet. Leave it wet, say for example 5 minutes for that bacteria to die. So, wait for 5 minutes. Wait for 5 minutes and then go somewhere else inside the room and then return. After 5 minutes of the time, you're going to rub, to dry it. Now, assuming it requires 5 minutes to kill because of the microbial survival is, say, 5 minutes. And then when you spray, in 1 minute it becomes dry. Then you have to repeat it. Right? Repeat it 5 times because every 1 minute it dries because perhaps of the humidity or the temperature in the room. So if you take a look at this, very important for IP, COVID-19 hours to days. And for the SARS-CoV-2, okay, you see, respiratory droplets, okay, contact surface, one who is infected will touch a plastic or the respiratory droplet fell into stainless steel, to copper, paper, glass, cardboard, wood, you see, 3 to 7 days. All of this, just go through this. So these are the microbial survival time. So if we know this is the survival of these microbes, then we have to buy a chemical that would have the potency and the effect to kill this. So follow the directions. Follow the label claims. If the label claims say it kills or disinfect COVID-19 or SARS-CoV-2, and then the direction to use, leave it wet for 5 minutes or 10 minutes, then leave it wet for 10 minutes. You see? Do you think our housekeepers knows that? If they used to work in a restaurant perhaps or at home? No. This is an entirely different ball game. See? So contact time, you already know. Definition, the total amount of time required for a healthcare disinfectant to remain in contact, see, with an environmental surface in order to inactivate all labeled microorganisms. See? Meaning, leave it there. Let it wet. Okay? And disinfect non-critical surfaces with an EPA-registered hospital disinfectant using the label safety precaution and use direction. Always, always. The label claims what type of viruses or bacteria can kill, and then the use directions, perhaps of the contact time, how many minutes it should be there, and safety precautions is very important. Does it require a PPE? Remember, we don't want to end up with an OSHA citation. Always protect our employees. Now, you must remember this. Yes, it is EPA registered. But if you are going to divert, okay, you're not going to follow the label claim. You're not going to follow the directions on how to use that chemical. And if, for some reasons, our employee or the resident got seriously ill as a result of the disinfectant, the company of that product will not be liable. they will not be liable. Okay? There is such thing as what we call product liability. And they will say no. Based on our investigation, they did not follow the direction on how to use, and when it requires a PPE and the contact time or the way, they did not follow. So always follow the labels and the use. Okay? Now, contact time considerations. You see, if you notice here, repeat for stubborn stains. Allowed to remain wet for 4 minutes. Do you think our housekeepers are reading this? I don't think so. See? So despite this type of chemical, therefore, it already shows here. So leave it wet for 4 minutes. And then after that, you can already dry it. Use another cloth and then, dry it. Now, if products with longer contact time poses a challenge, then switching to EPA-registered products with shortened time should be considered. You see? Did you get it? So say for example, microbial survival time for this is say 1 hour. And then the type of product that you use in order to kill that takes 30 minutes. Huh? Leave it wet 30 minutes. But if, so 30 minutes, so our housekeeper, will waste his time waiting 30 minutes, and then that's the time he's going to clean. If there is a product that can kill for 5 minutes, then buy that kind of product. No waste of time. Done. You see? And so, properly explained. Now, so total contact time, I've already discussed that with you. See? Contact times differs according to the type of bacteria, the viruses, etc. So all of you must follow the US EPA FIFRA standards. Total contact time is the longest contact time required. Remember? In that label you say, leave it there for 5 minutes, then leave it there for 5 minutes. You see? But you don't need to have a timer. Just a watch. Okay? Just a watch, and then 5 minutes done, then wipe it. Now, PPE is of course another layer in order to protect. Because we also have to protect our employees. They do these environmental services, and then we are not going to protect them. Then PPE is very important. So, the definition, because remember, PPE is part of your infection control program, right? Policies and procedures, and also of your environmental services. So this is the definition: specialized clothing or equipment worn by an employee for protection against infectious materials. It works both ways. You prevent to get infected, and you prevent also others, okay, your residents or co-workers from getting infected. So this is very popular nowadays because of the pandemic that we have. So this create a barrier, okay, between you and the germs. So this barrier reduces the chance of touching, being exposed to, and spreading the germs. We are not superman or superwoman. Okay? I've seen friends, okay, in serious condition. We should not take this lightly, my friends, but not to the point of anxiousness or fear. We still have to execute our job. We are in the frontliners. That's why we are called heroes. And that is the oath that we have taken. We are not going to abandon our residents. But in order to give them that sense of comfort and security, we must have PPE's inventory available. Your burn rate every day is fast, so you must have a dedicated person that works under the infection preventionist that monitors the burn rate of all of your PPEs. When it goes down to 50%, order immediately. Do not wait to go down under 50%. Always stock not less than 50%. And it must be properly monitored. Because these PPEs, they are not reusable. Some are reusable, right? But now, since we have already available PPEs, then never use the reusable. Dispose. Surgical mask, throw. N95, done, throw. Okay? But do not just throw. There is a way of disposing this. Biohazard bins, properly sealed. So, these are your PPEs. And there is a procedure. This is just a rundown, okay? And so the types of PPE that we have, we already know that. You are the master. Gloves, gowns, face masks, goggles, face shields and respirators. Nowadays, respirators is gold, N95. N95 is more, the protective barrier of a N95 is stronger than a surgical mask. See? But there is a way of when to use the surgical mask, when to use the N95. You will only use the N95 in the quarantine area and in the isolation room. Do not waste your N95. So if you are just there in the general population, then just wear surgical mask. If you are in the offices, just wear surgical mask. Everyone are required. Okay? We require everyone to wear. Okay? Face mask. Okay? Cover. If one refuse, I will terminate. If I'm the administrator, I'm going to terminate. Okay? So protect all of this. You see this. So what influences PPE selection? You don't just buy and buy, right? It must be carefully assessed. So infection prevention is what type of N95s are we going to buy? The goggles, the face shields, okay? The gowns. Okay? You don't just buy. You see? Especially the N95. Never, under any or all circumstances, my friends, do not buy an N95 if it is not NIOSH approved. You know what is NIOSH? NIOSH? National Institute for Occupational Safety and Health. I'll tell you, you will be given a deficiency if not a citation. N95 must be NIOSH approved. And in fact, there must be fit testing for all of your N95. Do you think that just because you're wearing an N95, you're already protected? There is such thing as a seal test. Okay? You put that on, and then you say, oh, it's already fit me, and it will not, all of this aerosol borne, it will not. My friends, there is such thing as N95 fit testing. The requirement is actually once a year under OSHA regulations. But because of the pandemic, what is required now is initial testing of the N95. And there are two ways of testing. One is qualitative, okay? Qualitative. The other one is quantitative. But they don't allow now the qualitative. You know the qualitative is? It's just pass or fail method, okay? You're like an astronaut. And then they have this, they will spray. I am a certified, by the way, N95 fit tester. That is not allowed for possible cross-contamination. We will use either the Bitrex or the saccharin, okay? Or the smoke or the banana flavor. No, we are not going to do that. If there is a requirement, then we use now the quantitative. You use the port account. But it is a very long story. Anyway, N95 is that easy, okay? It must be properly tested. Because once you're tested for the N95, that particular product, that particular size, whether you're small, medium, or large, permanently for 1 year, that is what you're going to wear. Because it has already been fit tested. So this will influence the kind of PPE that you have. Okay? You must be comfortable. It must not be too loose or too tight. It must not be resistant to tears. And if in transmission-based precaution, you're in the isolation, quarantine room, and it determines what kind. Okay? And of course, the type of exposure whether, okay, gloves will be enough and the mask, but if it requires a face shield, so all of this influences what type of PPE selection. I will just run this fast. You are the master. I'm sure you already know this. Donning and doffing. Okay? Very important. There is a sequence. And the sequence is to don is to wear. So wear the gown first, tie behind the back, then the next mask, and then the goggles or the respirator. The last will be the gloves. Inversely, when you remove it, you have to start with the gloves. Because failure to follow the process, you will get infected or you will be the transmitter. And before you do the donning, wash your hands. After doffing, wash your hands. Okay? This is just like a review for you. So, I'm sure you have seen this picture. In all of your quarantine room, in all of your isolation rooms, okay, you must have a donning station. Donning and doffing. Department of Public Health will see to it that you must have it. And it must be in your mitigation playbook. If you don't have it, automatic, you will fail in your focus infection control survey. There must be this drawing, okay, this graphic. What you see it? It must be there. See, in your donning and doffing station, it must be there. And including this one from the CDC. The sequence, same. It must be there. Because when they do their survey, they want to see. See? So that when those employees in the isolation quarantine room will start their donning and doffing, at least it is a reminder, very visual. See? Same thing, the sequence here. You see this, CDC? You can just pull this out from CDC website and then put it there. Gloves doffing is very important. Because again, hence, transmitters. So it's just not easy. Follow the steps, 1, 2, 3, 4. Okay, it's a one-time catch. When you pull, boom, automatically the hands must catch it. That's it, done. And then throw properly in the bin. Okay, biohazard, very important. And then wash your hands. Now, when we do our environmental services, we must do a visual preliminary site assessment. So focus, room. You don't just go to the room. Hey, housekeeper, go to room 123 and start disinfecting. No. IP, maintenance, and other concerned housekeepers, do a visual preliminary site. One, determine what kind of resident do we have, what kind of bacteria or viruses that he has. Identify what are the high-touch surfaces, the frequently touched surfaces by this resident when he comes into the room. What are the furnitures that we have here inside the room that this resident, frequently touches? Okay? And from there, you will now determine what kind of chemicals you are going to use. And the methods and the strategy on how to start your cleaning. So this is very important. But you don't do this on a daily basis. Because that resident will be there for how many months? So that same assessment that you make is only one time. Every day that this housekeeper will go there, it's boom, boom, automatic. No, remember this. To make it easier for your housekeepers to work on a residence room, remove unnecessary furnitures. Remove, because it will just give additional opportunity for a virus to be present. The more furnitures that you have, one, the resident, the more opportunity to touch those surfaces. Number two, it makes difficult now for your employee will spend more time to clean all of this. So if it is not necessary, remove. That is what we are doing now. There is no more, nowadays, no more aesthetic where, you know what, we will have visitor for admission. It has to look beautiful in the lobby, the corridors, the hallways, the resident. No more! Because we don't have visitors, we don't allow them. Remove unnecessary things along the hallways, along corridors to prevent environmental surfaces contact surface. Resident room, there is such thing as minimal. You know what is a minimalist is? Bare. Okay? Remove. So that is very important. Visual preliminary site. Now, cleaning basics. So now, we already did our visual assessment. We already know what are the high-touch surfaces, extremely touch. And then, we already know what the type of bacteria or viruses that we have here, and we already know what type of chemicals to use, okay, the label and how to use it. So how are we going to do the cleaning? The basics. Outside to inside, high to low, clean to dirtier. This must be mastered by your housekeeper. Okay. Outside to inside. You don't start inside to outside. If you clean first inside and then you go outside, then you're bringing the transmission of the virus. The cleanest is from the outside. You see? Always start outside from the room, then you go inside clockwise. You don't go emotion like crazy. You do whatever you want to do here and then you run there, mop there, clean here, clean there. No, there must be a system. Okay? Clockwise. But if the configuration of the bed is on the left side, then do the counterclockwise. There must be a pattern in the cleaning. And always the last, tell them, is the toilet. That is the dirtiest. You don't start with toilet and then you go inside the room. Then you are bringing the dirt. You're carrying viruses. You tell them. There must be a system in doing it. See? Outside to inside. This will just give you a picture. Outside to inside. See? This is counterclockwise because of the positioning of the patient's bed. See? If you notice here, there is a system, and then last, the patient room. I'm not talking here of just mapping the floor. We're talking here, remember, the high-touch surfaces. So, based on your visual assessment, the IP will say, these are the high-touch surfaces, okay? These are the ones, what's this? The door handles, the IV poles, perhaps, or the remote control, the call lights, etc. Already identified when the housekeeper will go there. But she's not going to do it like crazy. Oh, immediately go. No. Do this pattern. Okay? Last, always, the patient's bathroom. Now, done with the outside to inside, then the next is clean to dirtier. Now, you are already inside the room. Right? You're doing your counterclockwise or clockwise. Always remember, go from the clean to the dirtier. Because if you do dirtier to the clean, contamination. You increase. Right? What we want is to trap. Clean, move in. Okay? It's like a centrifugal, I'm sorry, I cannot express this. You know that what it means, right? So, do that. Shared equipment and common surfaces, and then item touched during patient care. The last would be, of course, the patient's bed. See? It's constricting. Out, going in. See? Before, see? Clean patient areas before patient toilets. Now, the same thing. Identify the high-touch surfaces. So, in high-touch surfaces, these are, always remember, frequently touch, high-touch. So, when you do that, do not, okay, identify high-touch surfaces, the resident's bed. Okay, the railings. So, you don't attack the bed first. You do the high-touch surfaces in the extremities first. See? For example, there is a TV, a remote control outside, the closet, the cabinet, okay? Or start there first, clean the high-touch surfaces, and then motion towards the middle. See? Now, terminal cleaning. Terminal cleaning is the extreme way of cleaning, disinfecting, or sanitizing the room. You only do this when you discharge a resident. Okay? Discharge a resident in the isolation room. Leave it vacant for 24 hours. Open the windows, okay, in order to the air to circulate. After 24 hours, do terminal cleaning. What is terminal cleaning? You are going to do the floor, the ceiling, the wall, any of the fixtures, any muebles or movables that you can remove, okay? All of them. Then you start the cleaning. Remove them from your room, bring them to the parking lot, spray them, and then all the wind, that is terminal. The next level to the terminal is deep cleaning. Furnitures and everything remain there. But every nook and cranny of that room, you have to clean it. You don't have to do the ceiling and the wall, the windows, no. That is for terminal cleaning. You see? But it depends on what kind of virus we have there. So, and, very important, the type of chemical. See? Then, the next is, outside to inside, clean to dirtier, last one is high to low. So, when you do your cleaning, you tell them, just to show here, when you do low to high, all these viruses, the bacteria, okay, down. If you start below, then you're bringing them up. What you do, you start up, bring everything down. Because the last one that your housekeeper is going to clean is the floor, right? The floor. Now, if she starts low, they bringing it up. See, cleaning floors last to allow collection of dirt and microorganisms that may have fallen. See? Always remember that. Okay? The basic. Outside to inside, clean to dirtier, high to low. Very basic. We're almost 12 and I will rush this. I hope you're not bored. Warnings. Never double dip cleaning clothes into portable containers. You know what is double dipping? You have a solution, you have a chemical, and you need to use a cloth in order to moisten the cloth in order to rub. Do it only one motion. Whoop. Then wash. Not 1, 2, 3. Oh, you're using the same cloth, it will now generate, okay, some form of a pathogen or viruses there. And never shake mop heads, you see, and cleaning clothes. Otherwise, it disperses dust and droplets. I mean, I've seen some of the housekeepers does that. You know, it's like a fun. They don't know that it disperses all of these viruses. Don't do that. And then when you use your bucket, okay, never leave soiled mop heads and cleaning clothes soaking in buckets. I have seen that. Perhaps out of laziness, they just leave it there outside in the laundry or the maintenance room. Yeah. And then they use it. The same. They are now carrying all of these viruses again in the building, useless. The best way is double bucket system. A double bucket system means you have your clean water in that bucket and you have your dirty, the bucket, the dirty water. So if I'm going to use now, okay, the mop, okay, clean, and then I'm going to mop the floor. So when I mop the floor, it becomes dirt, right? Dirty. I'm not catching the dirt. I tulo and everything. Do not, immerse it in the clean water. So I have another bucket. That is where I'm going to use the dirty bucket in order to press or to remove, this liquid, the dirt and everything. Okay? Do you get me? So that is the best way of doing it. Because useless. Only one. Initially clean water, and now when you're done, you use it again. Everything settles there. It now becomes dirt. So every time I'm going to mop, then I'm now, again, just, distributing, viruses. Now, this is just a mopping technique. Whatever technique that you use, okay, there must be a pattern. It could be snaking, it could be anything you want, but there must be a system. Okay? It's the same thing here. Mopping technique, you can see. There is always a way, okay? A pattern, a design. Then, when you do the corridors, the hallways, you don't cover them. You see this in the middle? You don't cover all the width of a particular hallway or corridor. Half, and then demarcate it with your caution cones. And then you see, he does not do it horizontal or vertical. There is always a pattern. Okay? And then, you see these mapping techniques? See, if you have a general area, you see the other one here, no? Yeah, this is as if they're just playing, right? It's like crazy. They're like kid, they're child, they're playing with the map. No, don't do that. There is always a pattern of doing the cleaning because what you're going to do, you want to prevent transmission. So if I map. So I'm moving all this dirt in the floor in such a fashion where I trap them in one motion. One motion. See? But this one, I'm spreading the dirt. And proper body mechanics is very important. Okay? Of course, we have to protect our employees from any injuries. See? Always proper body mechanics. Okay? Your body, okay, must be perpendicular to the ground. Is it perpendicular? Straight. Okay? 45 degrees. Straight. And then, do not use the strength of your shoulder in order to map. Instead, you use the strength of your hands, your hands, your arms, in order to map with a proper body posture. Would you imagine our housekeepers has been with us for 15 years and 20 years. And if they've been doing this, I'll tell you, workers' comp, continuous trauma, big time money. So train them. If you have new ones, always the proper body mechanics. Disinfecting non-critical items is also very important. So we're only thinking of environmental, right? The surface, how to clean, what disinfectant to use. How about non-critical items? So these non-critical items, this pertains to the equipments that, your nurses use, okay? The stethoscopes, the glucometers, anything that touches, okay, an intact skin. intact. The opposite to the intact skin is the mucous membranes, right? So this one that I have is are considered to be intact skin. Okay, so you have just go to this what type of disinfectant. Okay, and always when you buy a disinfectant, among all of these things here, pilot test, because all of these product manufacturers, all of these companies, they are competing, and they will tell you, you know what? They will even speak ill of their competitor. Just tell them, look, give me the opportunity for 2 or 3 days. I will pilot test. I will check whether it is strong, it is potent. So you do now your audit. You will ask the housekeeper, kindly use this chemical product. And after 2 or 3 days, tell me if it works well. Versus this one. See, pilot test is also important. Now, so these are your non-critical items. Blood pressure cups, scratches, bedboards, most neurological or cardiac diagnostic, electrodes, and other medical accessories. So if you see here, non-critical items are those that come in contact with intact skin but not mucous membrane. See? Other than the mucous membranes, you already know the openings, huh? Intact skin acts as an effective barrier to most microorganisms. Therefore, the sterility of items coming in contact with intact skin is not critical. That's why it is called non-critical items. See? So, key disinfection recommendations. Okay, just go through all of this because I'm running after time. I want to finish this at 12:15. I'm sorry. I have to do it 15 minutes because you are late. It's not my fault. Come up with the policy and procedures for this. On cleaning and disinfection, we already know that. And then focus on the surfaces in proximity to the patient and those that are frequently touched. High touch, always choose EPA registered disinfectants and always follow manufacturer's recommendations. Okay? Now, so when you do the cleaning and surface disinfection, think of two things: surfaces and equipments, because you only don't think of the surfaces, because the equipment is also part of the environment. You see? The stethoscope, the IV equipment, the monitors, the blood pressure cups. So you have this a packet of sterilized thing. Okay? So you use that. Before you're going to use that with another resident, clean, clean, clean. You see? Always. Our nurses, I don't know if you do that, but it's very important. So, including the equipments that you have, the patient care equipment, and including patient care equipment, you see, the telephones that they have, if they have computers, the tablets that they have in the room, clean them as well. You see? And of course, beware of glucometers. This is in many outbreaks in LTC and many federal tags in surveys. So there are two types of surfaces. I already discussed this with you, but I will make it clear. High-touch surfaces and low-touch surfaces. Very easy. High-touch, these are frequently touched by your patients or residents and by healthcare workers. Of course, the antonym of high-touch is low-touch, not subject, or they are infrequently touched. So the focus is the high-touch surface. And this must be identified by the infection preventionist. It will not take much of your time. See? 30 minutes, 15 minutes, you're done. And you're not going to do it every day because that resident will be there. Okay? Do it room by room. Of course, when are you going to do the low-touch surfaces? When you are going to do the deep cleaning and terminal cleaning. See? You will now cover the low-touch surfaces. And so high-touch surfaces require more frequent cleaning and disinfection than minimal contact surfaces. So you have to do it on a daily basis. Daily basis. See? So that is where your policy and procedure will come in. Okay? The frequency. Now, versus low-touch surfaces, you are going to do it on a daily basis, right? Only occasional. But that will be identified by the infection preventionist. So these are the high-touch surfaces. You just go through that motion. Very easy. Okay? You know this. You can already visualize the light switches, doorknobs, telephones, IV poles, utility carts, faucet handles, call lights, bedside tables, frequently touch. Edges of privacy curtains, you see? Yeah, you draw the privacy curtain, touched by the resident. See? Clean them. Okay? Or disinfect them. So these are just the high-touch objects, just for purposes of visualization. I don't have to go through this one by one. And these are the high-touch objects. See? So this is the role now of the infection preventionist. But of course, she is not going to do it just by herself. Maintenance here, housekeeper, come with me. Okay, we wear the necessary PPE. So you are going to educate them. See? These are the high-touch surfaces. All of this. All of this dotted, green, and round. See? All of this are high-touch surface. So at least they can already visualize. So when they go there, they know what to clean. So they are not wasting their time. They already know how to, clean this. Efficiency. So these are the high-touch objects or high-touch surfaces, just to give you an idea. Again, the bathroom, that will be the last. Remember, clean to dirtier. So low-touch surfaces are the following: floors, walls, ceilings, mirrors, window sills. See? You don't do this. You only do this when you do your terminal cleaning and deep cleaning. I don't have to go through this. You already know what are the low-touch surfaces. So what are your protocols for hand washing, for glove usage, for chemicals, changing maps, clean to dirtier, high to low, outside to inside? You must have this. So, how clean is your environment? You ask your question, how clean is it? After this seminar that we have, how clean is it? So you have to self-criticize yourself, do an assessment, accept responsibility. The problem with when we do our assessment, and then if there are certain, department heads or certain employees that in the process, in our assessment, they failed to observe certain policies and procedures, and we are going to call them, they will immediately react. What is that? We are doing this for everyone. Okay? It is us. It is not you. We are one. That's the purpose. I will more or less digress by my presentation. Attitude counts. Attitude. Attitude means you are open-minded. You welcome and embrace criticisms. No one is perfect. But there are department heads who are arrogant. And they have this misplaced pride. We don't want that kind of supervisors in our building. We don't want that. We want everyone to humble ourselves. If our administrator or any members of the board is going to call our attention, do not take it against them. It is for your own benefit. For you to become a better person. If I survive in this industry for 20 years, it is because, modest aside, because of my attitude. They can yell at me, they can shout at me, provided that they will not discriminate me. For as long as it is part of a professional argument or differences that we have, I welcome it. And I know how to say I'm sorry. It is very important. If we commit a mistake, do not defend. Okay? Just say, I am sorry, it will not happen anymore the next time. Okay? So how clean is your environment? So you will only determine that through a checklist. See? So you can Google. There are a lot of, materials out there in the Google. See? But I can share some with you. I don't know if I still have them. Then, deep cleaning checklist. You have that. Okay, go through it. Google search. What are the deep cleaning checklists? Very easy. Perhaps the supplier of your chemical. Then ask them, do you have a checklist for deep cleaning? I'm sure they have. They're selling the products, then they must have it. Okay? So how do you monitor terminal cleaning? You see? There is a CDC also, see? CDC environmental checklist for monitoring terminal cleaning. See? Terminal cleaning is an intense disinfecting procedure that involves removing every detachable item in the room for disinfection and then properly disinfecting light fixtures, you see, air ducts, and all surfaces from the ceiling down the floor. Versus deep cleaning, you don't go through this motion. Okay? The dirt and the grime in the floor, okay, anything that you don't have to reach your hands up is deep cleaning. You see? So terminal cleaning tracking log, you must have that, remember. You must track. There must be surveillance. For purposes of auditing, for purposes of performance evaluation, you must have it. And lastly, linen. Oh, I have already discussed this. Linen is part of environmental services. So you must have an infection prevention control program on linen, must have a policy and procedure. Okay, policies and procedures on handling of used linen, collection on transport of used linen, the laundry area, sorting and laundry. Why? Because this is one of the major source of spread of the infection. You see? You must have that. But of course, everything must start with assessment. So in that regard, provide staff education and competency testing. Accessibility to space and supplies. Performance monitoring and feedback must be important. Everything is not one-way street just because you are the department head and then everything is one way. And then if a housekeeper will say something, what do? You're like a military, okay? Where you want that they will just listen to you. You order and then they jump. You don't do that. The key to be an effective supervisor is to listen to criticisms and embrace them and come up with ways on how to, make them a part of your team. Because we have this mindset, oh, they're just our subordinate. You oppress them, don't do that. The more they become effective, functional, if you're going to take care of them, treat them as human beings, especially in this pandemic. Why do our employees abandon us? Oh, don't blame it merely to the pandemic. Why don't you ask yourself, they abandon you because they have no loyalty to you. Because during normal times, you are not good to them. That is one of the reasons. I should know that. Because some of our, clients, oh, you know what, Joey, they abandon. And I'm very brutal, I'm very frank. I said, you ask yourself why? Because you are mean to them. You are not fair to them. So in times of emergency, they will abandon you. So be good to your employees. Okay? So these are your infection control checklist laundry. Okay, go through that. Search in the internet. Okay, lots of checklists. They're all out there. I don't have to spoon feed you in that regard. So, almost there. So, everything, you have the policies and procedures, the assessment, all of the strategies, the methods that I've discussed with you. They are all useless, my friends, if we don't have a component on education. Educate. Okay. The reason why society is divided, the reason why just your own family is divided, because we don't communicate well. Communication is very important. So, communication is a component of education. But it's not just easy to communicate. You must have the proper tools, the policies and procedures. And how easy is it to, to communicate those policies and procedures? Make it easy. If you can do it by a drawing, a graphic, better. You see? Instead of talking for 1 hour, they are drowsy, they're sleepy. But if I will just show a picture, or if I can have someone role-playing, okay, or do it demonstration, that is the best education. You see? So, who needs to be educated? Everyone. When are they going to be trained? Just go through this, of course, on hire. Do it annually. Okay? Every time you have new products, every time you have new policies and procedures, when indicated due to surveillance. Surveillance is monitoring. You monitor something went wrong. Okay? Then you are going to come up with a revision of your policies and procedure. Education is basically after we train them, after we educate them, there must be competencies training, okay? You have to demonstrate to me that you really understood. It could be via an exam, or you come up with a quiz, or it could be simply skills training. Okay, demonstrate to me. Now, every time they commit a wrong, an error, please do not shout at them. Do it in a caring fashion. Okay? The best human resource are your employees. They're your best human resource. Treat them well, but fairly. Do not play also favoritism, because if you do that, you end up with a case of discrimination. Okay? Be fair. So when I fair, it should be uniform, uniform, and consistently. Okay? Apply it to everyone. So document the competency assessment, because of course you're going to do that as part of the performance evaluation. So in short, the EVS staff, okay, environmental services staff. So you must have in your policies and procedure, when do they get trained? Of course, during the orientation, they must be trained already. And who trains them? It's not anyone who's going to train. Okay? But of course, the trainer. If I have an environmental staff that has been with us for 15 years, I guess because of her seniority, I will, give her the authority. That is what you call empowerment. You don't have to do things all by yourself. The worst supervisor that we have are micromanagers. Okay? Because if you do that, you become inefficient. It becomes annoying. You're always on the back of an employee. Know how to delegate. But of course, you're going to delegate, you empower, but provide all the necessary tools, the necessary education. You see? Trust your people. Trust them. And if you do that, then you recognize them, or they become a better person. Always give credit where credit is due. If they're good, just tell, oh, you did a very good job. You see? Tap them on the back. Very good. Okay? Those words motivates your employees. They really motivate your employees. And if you make a mistake, just say, you know what? I am sorry. The hardest part for a person to say is, I am sorry. If you're arrogant, then you're not going to say, I'm sorry. But believe me, you're not going to succeed in life or in your work. Okay? So who does the competency with them? Okay? Determine that. Who audits them? And then these are the education content. I still have 5 minutes. I'm watching. I have my clock here in front of me. So, the training content, at a minimum, okay? IPC stands for the Principles of Infection Prevention Control. So, you just go through this motion, transmission of pathogens, the key role, etc., when and how to safely prepare and use different detergents, how to prepare, use, reprocess, and store cleaning supplies and equipment. Every time I go to this room where you store your bucket, your cleaning supplies, they are so dirty. That in itself is already, the bacteria and the viruses are already there. So when you bring your mops, your buckets, and everything, it's already a carrier. Now always remember, when you get out of a residence room, housekeepers, do not wear the same gloves. Do not wear the same clothes that you use in wiping and cleaning. See? Because I notice the same gloves every room. You are a carrier. When you leave, throw them. Then the cloth that you use in that room, do not use that in another room. But if it is a general population where you don't sanitize and disinfect, it is just simply cleaning, well and good, no problem. Wear the same gloves, okay? Because general population, no viruses, no bacteria, okay? That's why visual assessment, by everyone, especially headed by the infection preventionist, is very important, okay? So, all of this, just go through this. Anyway, I'm going to send you all of this and then select appropriate. Okay, we already know that. Conduct periodic competency assessments and refresher trainings. So, these are the IP and EVS staff. IV infection preventionist, EVS environmental services staff. You see the role. So the IP assist with policy and procedure, revision, implementation, assist in the product selection, okay, assist with determining topics of infection control training. IP could attend department meetings and huddles. IP provide training. IP assist with development of tools to, all of this. And then we have the EVS staff. What role will they play? So just go through this. This is just a guide. This is part of your institutional framework. So you're coming up with an institution and you want to make it functional. And you must have, what would be the role. Okay? So these are the major key takeaways. The healthcare environment is a key player in the transmission of infection. Now, you're already educated, right? There are two ways of getting infected or transmitting. Direct contact, one we are discussing now, is indirect contact. So, effective cleaning and disinfecting requires, okay, rule of thumb, it must be HEPA registered. And then, selection of tools and disinfectants, it must be evidence-based, okay? You don't just buy, go to EBS, CBS, or Rite Aid. No, you don't do that. There must be prior assessment. And then the contact time is very important. The label claim, the contact time is very important. Read. I bet, if they have read it, I really do not know. Cleaning and disinfecting from clean to dirty. Off-labels use, avoid. What is in the label? Follow the label. Education, of course, is critical. And then cleaning, disinfecting, and performance is everyone's responsibility. And of course, monitor, monitor, monitor. And then, fundamental question, once again, very important. This is the last 2 slides. What role does the environment play in the transmission of healthcare-associated infections? It plays a huge role. The cleaner the environment, meaning lack of pathogens because of what we did, the cleaning, the disinfecting, the less spread of infection. But we should know, okay, what chemicals and how to use it and what surfaces to touch. And we know that these are the high-touch surfaces. The better prepared the environmental stuff is, the less spread of infection. So what do you mean better prepared? We have to educate them. You know, that's the problem we are with us. We hire these housekeepers, the laundry, and then we tell them, start. I mean, we're not even training them. It's just like giving a person, a poor person, who asking money from you because he wants to eat. He wants to buy a fish for that matter. Instead, you have a fishing rod, just give it. Oh, here's the fishing rod. Go catch a fish. You don't do that. You have to teach that person how to catch the fish and see to it that he was able to catch the fish. Okay? I can be good in anything. I'm very good in talking. Useless. I have to see to it that that my pupils, that my my students has learned. So I should have indicators. I have to see to it that they have learned. Okay? Then the better prepared the entire staff is the less spread of infection. How to prepare the staff? Oh, we already know this. Education, competency testing, and auditing. So final, this one, you have to start today. Remember, indirect contact, the surfaces. So in order to avoid contact surfaces, then less furnitures, right? Less cabinets, less chairs. If you see in the hallway, there are cabinets there or, cabinet stand, which is not necessary. Remove. Maintenance, please remove. And then you see your residence room. There are certain furnitures that are not needed. Remove. So modify your office spaces. Clutters. I've seen that. Remove. There are papers in the business office that has been there for 10 years. Remove. Okay? Modification for residence rooms. Well, that is where I said, those furnitures that are not needed, remove. Modification for common areas, always in corridor. The same thing, do an assessment. And then when you meet, do not meet in a very tight space room. Why don't you meet in the activity room, in the common areas? Because we don't have activities, communal activity. We don't have visitors. Distance of 6 feet. Okay? Administrator, every morning perhaps you have your stand-up meeting. Okay? And then 6 feet. Do not have it in your administrator's room. You can have it there. At least it is visual. It will show to your employees that they are practicing what they preach. That is very important. Okay? Do it. At least the employees will know. Because if we don't do it, they don't see anything. Do you think they're going to follow you? Oh, even them, they are not doing it. They're not practicing. They're always within 6 feet. See? Practice what you preach. So my friends, I am done. I have not seen you. How can I see you? I will not entertain questions because it's already past 12. Ronald, how about this? Are you still in? Every one of you?
Yes.
Okay.
Here.
Can I see them? How do I do this before we end?